Welcome to the INICET Recall Part 2. Now, this recall is not to estimate your marks because, as you know, that there were many questions on multiple option corrects, match the followings, which can't be fulfilled, and many of the questions couldn't be recalled also. So, this is only to see that how your exam went. Coming to the subject of pharmacology, correct answer except dronabinol. So, it is excreted in urine will be the answer. Not a property of rifampicin should be given with fatty food. Drug acting by VEGF inhibition is ranibizumab. Not true about rimegepant. It is used in acute treatment of migraine. Treatment of choice of cryptococcal meningitis. It is simple. Liposomal amphotericin B with flucytosine. Now, pharma question was very much tricky. I saw. Not a side effect of beta agonist is hyperkalemia. Sodium potassium ATPase inhibitor was asked, and the answer was digoxin. HIV with pulmonary TB. This is direct repeat from NEET PG and FMGE 2025. So ATT followed by ART to prevent Irish immune reconstitution syndrome. So ATT followed by ART 2 weeks later with increased dose of dolutegravir. Identify the parasite and crab image was given, so the treatment of choice is praziquantel. Schizophrenia on haloperidol with stiffness, muscle rigidity, neuroleptic malignant syndrome, so the drug of choice is trantoline. Pre-exposure prophylaxis drug approved recently is lenacapavir. Another was, I think, given uh, tenofovir plus emtricitabine. MDR-TB, peripheral neuropathy, it is due to linezolid. Match the following was given: arsenic, the antidote is bal, opioid naloxone, alcohol fomepizole, benzodiazepine flumazelene. Ivermectin drug of choice for Onchocerca volvulus and Strongyloides tergolaris. Finerenone false, it is approved as an antihypertensive. TRC curve was given, synergistic effect was shown, and the answer will be physostigmine with acetylcholine. Drug acting as prostacyclin receptor agonist in pulmonary hypertension, selexipag. Lafutidine H2 antagonism increases somatostatin and increases gastric blood flow. Physiology image of sodium potassium ATPase was given. P glycoprotein image was given. Most stable long term mechanism of homeostasis is change in urine output. PV loop, it was given that the PV loop is increasing, so the answer will be peripheral vascular resistance increase. SBP falls during normal inspiration because the venous return is increased and the RV wall compresses the LV, so it reduces the LV filling. Hypothalamic nucleus affected in leptin dysregulation, so this is the arcuate nucleus. Which part of brain is involved in scanning the visual field? Frontal eye field. Repetitive nerve stimulation shows decremental response in myasthenia gravis because the acetylcholine in the presynaptic terminal is exhausted. Which of the neurotransmitter is correctly matched with its site? Serotonin, raphe nucleus. Which secretion has least amount of sodium? Saliva. Plasma magnesium level is regulated by renal absorption. In pediatrics, term baby with respiratory distress resolves spontaneously bulging fissure sign. This is TTN, transient tachypnea of newborn. It is seen in full term babies. A boy with developmental delay obesity should have been the clue. So only one syndrome is associated with obesity. It was given in my digital image bank. If you are preparing for any further exam, then you can check out my digital image bank. The link is given in the description and pinned comment section. So the answer will be Prader-Willi syndrome. A 10-year-old child with abdominal pain, vomiting, NEET 2023 question, PH, so DKA patient in a child, IVF should be 20 ml per kg. But if the N by 2 saline was given, then the answer will be 10 ml per kg where NS was given. If N by 2 was given in 20 ml per kg, then the answer will be 10 ml per kg. But ideally it is 20 ml per kg. Milestone correctly match transfers object at 6 months. Child 7 years with short stature, upper segment is to lower segment ratio 1.4 is to 1. So this is a case of achondroplasia. 10-year-old child with segmental fibrosis, poor response to steroid. That means it is not a minimal change disorder. There is fibrosis, so it is focal segmental glomerulosclerosis. Progressive jaundice, pale stool, high colored urine, HIDA scan shows no excretion. Next step will be liver biopsy. Child with fever, abdominal pain, BP is stable, platelet count is also more or less stable. If it was less than 10,000, then you need to give platelet transfusion and there is no bleeding also. So 7 ml per kg per hour ringer lactate and PCM will be the answer. Continuous murmur, left intraclavicular, PDA. Not used in status epilepticus is ethosuximide. A 3-year-old child with recurrent infections has weight gain, hirsutism, neurodevelopmental is normal. Next best step is serum cortisol, evaluate for exogenous Cushing syndrome. Image was given and externally rotated, so the answer is anterior dislocation of shoulder. Can't make O, median nerve. Match the following: equinus, foot of plantar flexion; planus, longitudinal arch of foot flattened; cavus, longitudinal arch of foot extended dorsally; and calcaneus, foot in dorsiflexion. In PSM, calculation question was given, so it will be, I think, 21, not 2.1 per 1,000 persons. Why is PM 2.5? It is very much in news regarding the pollution harmful because it can enter the alveoli. A study finds that exercise reduces the incidence of cardiovascular risk, and who have exercise they tend to have healthier diet, so the diet is a confounder. In a study where p-value is significant and it is 0.03, it implies that there is 3% probability that result occurred due to chance, not a component of Barford Hill criteria sensitivity. A previously vaccinated healthcare worker with needle stick injury, HBs AG positive, but is non-responder, so give 2 doses of HBIG. According to NPNCD, which of the following screening is done? So VIA for cervical cancer is done, visual inspection for oral cancer is done, and screening starts beyond 30 years in cervical cancer. Role of family beyond reproduction: providing support during illness, influencing cultural and health related behavior, providing emotional and financial security. Correct regarding Niti Aayog, it helps to evaluate and compare performance between two states. It encourages healthy competition among states. It supports formulation for improving public health system. Case control study: which of the following was true? Multiple controls increases the power. Selection bias is more in hospital. In pathology, seen in Hirschsprung's disease is failure of migration of ganglion cells. Causes of intestinal obstruction: non-coordinated peristalsis, acute rheumatic fever, criteria, carditis, polyarthralgia, chorea. True regarding Gaucher's disease, glucocerebrosidase deficiency, and crumpled tissue paper appearance. It was also given in my image bank. So PJS is STK11 loss, arborizing hematomatous polyp. Mantle cell lymphoma was given, cyclin D1 and SOX11. Stains, so Jimsa mast cell purple color staining. Correct regarding rheumatoid heart disease, shows ASOP bodies, group A beta hemolytic streptococci, and 2 weeks post sore throat it occurs. Microcytic hypochromic anemia, Menzer index is 11, so it is pointing towards thalassemia, and hemoglobin electrophoresis will be the answer. Retinoblastoma false, it is unilateral, guardian of genome, RB gene, and RB protein is hypophosphorylated in active state. Microcytic anemia, IDA, thalassemia, and lead poisoning it is seen. Lipid is best visualized in frozen section. True regarding RAS gene is it is constitutionally activation of GTP binding protein leads to continuous activation of MAP kinase signaling. Onion skin fibrosis is seen in PSC. A female with mitochondrial disorder, it is going to most commonly occur in cardiac and skeletal muscles, where it is more located where mitochondria is present in more number. Neuroendocrine tumor images were given, so you will have to identify which images contain the neuroendocrine tumor. In anesthesia, greater palatine nerve block was given, and which of the following was incorrect regarding ketamine? So, incorrect regarding the advantage of ketamine. So, produces dissociative anesthesia. Which bone articulates with atlas? Image was given, occipital bone. Among the foramen, which muscle supplies the muscle of mastication? Which nerve supplies the muscle of mastication? Foramen ovale. Correct matching was inferior colliculus and MCP. Which structure is associated with dysphagia and dysarthria? Tensor veli palatini. This anatomy paper was also very much difficult. Which of the following bones do cranial nerve pass related to the CNS? So, if it is related to the CNS, means the nerves of number one, olfactory and optic nerve are only arched. So, the answer will be sphenoid bone. Which of the histology is not associated with endocrine function? That will be the histology of endometrium. Opening the mouth muscle, that is lateral pterygoid, incorrect, attached to the medial side of the ramus of mandible. Not associated with ischial spine is tendon of obturator externus. Match the following. This will be the match the following with the arches. Most common for Berry's aneurysm is anterior cerebral artery, which does extension and hip, or the image was given of attachment of gluteus maximus. So the answer will be gluteus maximus. Steps of PCR: denaturation, annealing, and extension. Rheumatoid arthritis, epigenetic change where there is increased TNF alpha and IL-6. So there will be inhibition of methylation. Cancer cells shows length of specific RNA compared to normal. The reason is alternate splicing. M13 bacteriophage vector phage expression. During B cell maturation, allelic exclusion, this will be VDG rearrangement. Vitamin which is involved in the kynurenate pathway, so it is the pyridoxal phosphate. Nobel Prize in Medicine, I had posted it in my WhatsApp and Telegram channel also. So it is regarding the peripheral immune tolerance. Match the following: tyrosine, thyroid hormone, tryptophan, melatonin, glycine, creatinine, cysteine, taurine. Plasma magnesium level maintained by renal reabsorption. Deficiency of which enzyme causes increased 2,3-BPG? Phosphoglycerate kinase deficiency. Von Gehr's disease, most common finding is the fasting hypoglycemia. Which TCA intermediate is used for fatty acid synthesis? Citrate. Megaloblastic anemia with folate supplementation worsening of neurological symptoms. It is the classical folate trap. Repeatedly asked PYT. Features of HMP shunt transketolase: requires thiamine, it does not produce ADP, and non-oxidative phase is reversible. Not true about the beta oxidation of fatty acid. ATP is utilized in transport of fatty acid across mitochondrial membrane. Carnitine shuttle, correct statement. There are two CPT enzymes, CPT1 and CPT2, located on the mitochondrial membrane. Last part of the recall, I am going to release it soon. So if you don't want to miss it, then subscribe to my channel.